Ladies and gentlemen, opioids continue to get worse in the country. Nothing has changed. This thing is just getting worse by every second. And, you remember when Trump put together that opioid task force? You don't even hear him talking about that anymore. He doesn't talk about it at all, actually. So, this story came out on Pop Sugar, and it says that the addiction and the deaths across the country continue to grow. So, this is August 3rd, 2020. I mean, how many people are surprised? Actually, I'm not surprised at all, but I thought, since Trump had his little task force, that he would at least talk about this more, but he doesn't seem to he doesn't talk about anything. I guess if it impacts him negatively, his political career, he could care less. So how bad is the opioid epidemic in the US? Opioid addiction was the biggest US health crisis since the Spanish flu in 1918 until COVID hit. Unfortunately, the coronavirus outbreak is only making the opioid crisis worse. In New Jersey alone, drug overdoses increased by 20% amid the pandemic, as social distancing has made it harder to get treatment and attend meetings. Additionally, recovering addicts have found it difficult to stay sober. According to the National Institute on Drug Abuse, 128 people died from opioid overdoses every single day. And you notice how they always lower and then up the number. It's way more than that. Countrywide, come on, they're not fooling nobody. Which includes prescription pills such as OxyContin, Percocet, and Vicodin. Pharmaceutical fentanyl, which is 80 to 100 times stronger than morphine and heroin. In 2018, the US saw an estimated 68,557 overdoses. Of those cases, some 47,590 involved opioids and 31,897 involved synthetic opioids. The crisis has had a direct effect on American families. According to a 2019 study, the ripple effect, the impact of the opioid plague on children and families. 8 million children lived in a household that had at least one parent who was addicted to opioids between 2009 and 2014. Every person in any given family can be affected by the plague, from pregnant women to teenagers who make one bad decision at a party. This is the worst drug addiction uh, in the US ever. So they're saying there has not been any drug addictions prior to this that is worse than the opioid plague. So this one is the absolute worst. Experts agree that the country still faces a long uphill battle against opioid addiction. Dr. Andrew Kolodny, co director of the opioid policy research at the Heller School for Social Policy and Management at Brandeis University, and executive director of Physicians for Responsible Opioid Prescribing, told Pop Sugar that the opioid addiction is affecting families now more than ever. This is the worst drug addiction plague the United States has ever faced, he said. The current plague has really affected suburbs and rural areas more than inner cities, though the use of opiates skyrocketed throughout the US. In general, fentanyl might be the hardest substance to overcome, as of late, especially where young people are concerned. Dr. Joseph DeSanto, an addiction specialist and a BioCore RX partner, who has been sober from prescription opioids for 8 years, is currently helping others kick their addiction in Casa Mesa, California, as someone who began taking prescription pills after a kickboxing injury. Dr. DeSanto knows how difficult it is to break the habit. And while he's seen his fair share of patients who are addicted to heroin and prescription pills, in his experience, fentanyl, even harder to kick as of late, especially for teens. It's really making it, difficult for young kids who don't have other perspectives on any drugs, on any other drugs. So they're saying they are really turning hard on these opioids. These kids are really having a difficult time beating the habit of being on opioids. And it's even worse if they're doing the opioids along with the synthetic fentanyl, which seems to be the case. Okay, so he said fentanyl is a dirtier drug and it takes a lot more steps to process in the body. So it works faster and it's a much stronger high too. That's why so many of the young people are attracted to it. So, how many families are becoming addicted? If you want to trace the current opioid plague back to its origin, starting with pharmaceutical companies' campaign to assure the medical community that opioids were safe and non addictive in the late 90s, under the impression that people couldn't become hooked on painkillers like oxycodone. Physicians began prescribing, yeah, they went giving people 500 pills a pop. Remember, they wouldn't give black people pills like that because they said we would turn around and sell them. But look who's selling them. It wasn't us. Okay. Well, they're always accusing us of something. Physicians began prescribing opioid at, these crazy astronomical rates and giving people large amounts, while patients with terminal illness deserve to live out the remainder of their days as pain free as possible. Many medical professionals began prescribing some form of opiate to Americans, whether they got a root canal or went for a routine surgery. The medical community has been overprescribing, and they're still doing it, y'all. They are still overprescribing to this very day. But they talk in this article as if, oh, well, they did that back then. They don't do that now. No, they still do it now. Okay, so the medical community have been overprescribing in response to the multifaceted marketing campaign that was disguised as education to improve pain treatment. Dr. Kolodny said the CDC reported 191 million opioid prescriptions were dispensed to Americans in 2017, more than any other country in the world. On the streets of New Jersey, it costs $60 for one OxyContin pill, which is really just a synthetic version of heroin. Young adults basically got their first taste of the drug from a doctor or dentist. Maybe they like the effect. They're not certainly, they're not afraid of taking the drug, you know, and we have seen the photographs of them completely knocked out in cars, and sometimes children were in those cars and even infants. Okay. But abusing prescription medication is just the beginning of what can be a lifelong drug dependency. According to the National Institute of Drug Abuse, people who use opioids for the first time recreationally face an even bigger risk compared to those who never tried the prescription. In 2014, researchers concluded that heroin was more readily accessible and much less expensive than prescription opioids. So, and we know the street drugs that that's always been a big thing. That's why China pretty much flooded the US with all that fentanyl. It was cheap, it was easy for people to get, and they started using it. And they mix fentanyl with virtually every drug out here. All right, so however, a bag of heroin can go for $5 or $10, according to the DEA. We're in the middle of a huge fentanyl plague throughout the state because it's so cheap. And people say, oh, it won't happen to me. I live by the beach or the suburbs. And, the suburbs and the rural area is actually where it's worse as far as this addiction is concerned. But, ladies and gentlemen, the opioid addiction has exploded during this pandemic, and it's largely being ignored by, many. But, y'all, please tell me what you think about people buying this drug, and people are still dying every single day in this country on opioids, and not much is being talked about it. And like I said, Trump has his coronavirus committee. You don't hear anything out of them. You don't hear. I think the last time I heard anything out of his committee must have been about 2-3 years ago, and haven't heard anything since. That says a lot right there. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.